Have you noticed a persistent drop or feeling of looseness in your shoulder? This could be shoulder subluxation, a common condition where the ball of your arm bone partially slips out of its socket. While frequently seen after neurologic events like stroke due to significant muscle weakness, shoulder subluxation can also affect individuals with connective tissue disorders like Ehlers-Danlos syndrome due to joint laxity, or even occur after trauma. If you or a loved one has experienced a stroke, you might be experiencing shoulder pain, which actually affects up to 84% of patients after stroke. Shoulder pain in stroke patients occurs within the first 2 to 3 months, but sometimes as early as 2 weeks. Studies show that between 17 to 81% of stroke survivors develop shoulder subluxation, making it one of the most common complications we see in stroke recovery. Regardless of the cause, understanding what's happening is the first step to finding relief and improving function. Hello, and welcome to Rehab Lab. Here, you'll gain insights into restoring function and quality of life. The goal is to demystify musculoskeletal and neurological conditions so you can feel more confident in your recovery journey, no matter what the cause. You see, with proper understanding and targeted treatment, shoulder subluxation can be effectively managed and significantly improved. Think of your shoulder joint as a ball sitting in a shallow socket. Normally, strong muscles around your shoulder, including the rotator cuff muscles like the supraspinatus, infraspinatus, teres minor and subscapularis, and the muscles that control your shoulder blade like the serratus anterior and rhomboids, work together to keep this ball properly seated in its socket. But when these critical muscles are significantly weakened, whether due to nerve damage from a stroke causing placidity, or if the surrounding ligaments and joint capsule are inherently lax due to conditions like Ehlers-Danlos syndrome, or even after certain traumatic injuries, that delicate balance is lost. Gravity and everyday forces then pull the arm bone downwards, causing it to partially slip out of position. That partial displacement is what we call subluxation. It's the integrity of the surrounding soft tissues and the muscle strength that normally maintain its delicate balance. When the shoulder is subluxed, you may feel a depression on your outer shoulder. The persistent downward pull can stretch the joint capsule and the ligaments, leading to ongoing instability. If unmanaged, subluxation can cause a cascade of problems, such as significant pain due to nerve compression or muscle strain, joint stiffness often progressing to a frozen shoulder, and ultimately it will significantly slow down your recovery and rehabilitation progress by making functional movement difficult and painful. It can also lead to nerve irritation or even injury, and this will affect sensation and cause further weakening. The approach to treatment is relatively straightforward. First thing is prevent any worsening. Next, we need to manage the pain. Then we need to protect and support the shoulder and restore its function. Now let's talk about managing the discomfort often associated with subluxation. Controlling pain and improving proprioception, your body's sense of position in space, are crucial aspects for management. Treatment options include elastic or kinesiology taping, like the kinesio tape, applied to help support your shoulder and provide sensory input, reminding your brain where your arm should be positioned. A comprehensive review of 9 studies involving 424 patients found that kinesiology taping reduced pain, improved subluxation, and moderately enhanced activities of daily living. This simple, low-cost intervention provides meaningful improvements. Gentle, hands-on treatments from a therapist can improve joint mobility and reduce stiffness. You can also use ice or heat therapy to manage pain and muscle spasms. Beyond these, specific pain management strategies, possibly including carefully managed medications under medical supervision, might be discussed with your physician to allow for more active participation in therapy. The goal is to reduce pain so that you can engage in active rehabilitation, and then over time, the goal is to become less reliant on medications. Research has shown us that preventing further injury and providing support are key goals. This means everyone involved in your care, including yourself and caregivers, need to understand how to handle the affected arm safely. Never lift or move your arm by grabbing your hand or your wrist alone. This can worsen the subluxation and cause further soft tissue damage. Instead, when the arm lacks stability, use supported devices like armrests, if you're in a wheelchair tray, or specially designed slings. Proper positioning in bed is also vital. You could also do something that's called a pillow sandwich, where one pillow strategically placed behind the shoulder blade ensures its proper alignment, and then another under the forearm to support the actual arm. This will help keep the shoulder blade in the right position and the glenohumeral joint centered. This protection prevents additional injury and gives your recovering muscles and stretched tissues the best possible chance to heal and strengthen. You might be wondering if wearing a sling is a good idea. While slings can offer temporary support and protect the arm from accidental injury, they come with important considerations. On the pro side, they can prevent further stretching of the joint capsule and provide comfort. However, there are significant cons to wearing traditional slings. Over-reliance on slings can lead to increased joint stiffness. It can even cause a frozen shoulder, which could take up to a year to reverse. Slings can also reinforce abnormal movement patterns and learned non-use. So this is why therapists now prefer dynamic slings or specific positioning devices that allow for some arm movement and encourage muscle engagement. Some examples: the humeral cuff sling or the Bobat sling. The goal is to encourage muscle recovery and functional use, not just passive support. Discuss the most appropriate type of support or sling with your physical or occupational therapist. One of the most proven treatments is called neuromuscular electrical stimulation, or NMES, sometimes also known as functional electrical stimulation, or FES, interchangeable terms. See, this involves placing electrodes on your shoulder muscles and using gentle electrical currents to make them contract. Studies have shown that using electrical stimulation for about 30 to 60 minutes every day for about 4 to 6 weeks can significantly reduce shoulder subluxation and improve function. See, a large review of 11 studies involving 432 patients showed this treatment has a substantial positive effect, especially when started within the first few months after a stroke. What this feels like? The electrical stimulation creates like a tingling sensation and causes your muscles to contract gently. Many patients describe it as similar to a gentle massage with a muscle twitching. As your muscles begin to wake up, you'll progress to exercises that help strengthen your shoulder in a gravity-reduced environment. See, this might include sling suspension exercises where your arm is partially supported while you practice movements, or weight-bearing activities on a table. Sling suspension slides speed up recovery. A recent 2024 Korean study of 28 stroke patients found that 4 weeks of sling suspension exercises significantly reduced subluxation on x-rays, decreased pain, and improved strength and overall arm function compared to other exercise methods. As your strength improves, your therapist will guide you through exercises that gradually incorporate gravity, such as active range of motion movements in sitting or standing, and eventually light resistance training. This progressive approach ensures your shoulder regains its full functional capacity and dynamic stability. Maintaining range of motion and preventing secondary problems is also vital. Most shoulder subluxation happens in the first 8 weeks following a stroke, so early intervention and ongoing monitoring are key. This involves daily gentle stretching within a pain-free range of motion. Now, what you want to avoid though is stretching or range of motion involving overhead movements, and also avoid heavy lifting as they can worsen the subluxation. Now, your therapist will guide you through the progression and advancement. Also, if pain increases or something's going on, then your physician can do ultrasound, physical examination, or x-rays to catch any problems early. The key message from current research is clear. Early intervention with the right combination of treatments can make a significant difference in managing shoulder subluxation. Remember, managing this condition is a team effort. Your physiatrist, physical therapist, occupational therapist, and even nursing team play vital roles in helping you. Here's an action plan you can discuss with your team. First, set up the pillow sandwich for proper positioning to protect your shoulder. Next, when sitting, ensure you use an arm-trough or a lap tray if needed. Keep the shoulder supported when sitting. Next, you can ask your therapy team about neuromuscular electrical stimulation. And finally, incorporate gentle scapular squeezes and other recommended strengthening exercises safely at home, as guided by your therapist. Proactive and consistent application of these strategies is what leads to the best outcomes. For stroke survivors or those with significant weakness affecting the arm control, proper caregiver support is absolutely crucial to prevent further injury while doing transfers and repositioning. Always support the elbow and the shoulder together when moving the affected arm. Never pull or lift the arm by the hand or the wrist alone. This will make it a lot worse. Your healthcare team can guide you on the proper handling techniques. Shoulder subluxation, whether from a stroke, Ehlers-Danlos syndrome, or injury, is a challenge, but it's not something you have to simply accept. With proper early and consistent treatment, most people see significant improvements in their shoulder position, pain levels, and overall arm function. Early combined care is key, including mechanical support to protect the joint, neuromuscular reactivation using electrical stimulation to wake up sleeping muscles, progressive strengthening as your voluntary control returns, and effective pain management to keep you comfortable enough to participate actively in therapy. This multifaceted approach leads to a stronger, more stable, and pain-free shoulder. Research proves it. Remember, recovery is a gradual process, and your rehab team will work with you to develop a personalized treatment plan that addresses your specific needs and goals. To help you and your caregivers, download the free one-page positioning cheat sheet. It provides a quick, easy-to-follow tips on how to properly support the arm and prevent injury. You can find the link below in the description. Now that you understand what shoulder subluxation is and why it matters, you're probably wondering what specific exercises can help. In our next video series, we'll dive into actionable exercises you can do at home to address shoulder subluxation, focusing on muscle activation, strengthening, and stability. Don't miss it. Tap to subscribe, leave comments below, and see you in the next video series.